Hello, my name is Angela Vasha, and I am a nurse leader here at Nebraska Medicine. I am really excited to talk with you all today about the project that we hope to engage with the senior student design team on. My role here at Nebraska Medicine is to serve as the director of special pathogen programming focused on isolation and quarantine. And I also have the honor of being a scholar in our Global Center for Health Security. Nebraska Medicine UNMC have a mission to lead the world in transforming lives to create a healthy future for all individuals and communities through premier educational programs, innovative research, and extraordinary patient care. This project that we're coming to you to seek a student team for exemplifies all of these elements of our mission. We have been working on a project with the Centers for Disease Control and Prevention, as well as the Administration of Strategic Preparedness and Response for the last 2 years. One of our goals and our focus areas is to be able to provide expert consultation to small and rural healthcare facilities, specifically focusing on infection prevention and control. There's been a lot of work done over the last 3 to 5 years focusing on telehealth and telemedicine. One of the things that differentiates what we're trying to achieve from programs focused on patient care is that we want to provide support to the frontline healthcare personnel who are responsible for ensuring that the infection prevention and control programs are in place to decrease hospital-acquired infections, to improve patient safety, increase patient and family satisfaction, and decrease risk to the staff. One of the challenges that we find with providing support services for small and rural healthcare facilities is that the infrastructure that would support a virtual consultation is not always as robust as we would like it to be. Our team identified that we wanted to be able to provide expert consultation from subject matter experts here at UNMC and Nebraska Medicine throughout the United States. When we started to put together a project plan, we recognized that we wouldn't be able to have on-site, hands-on consultation for all of these hospitals with our small team of subject matter experts. So what we wanted to do was create a virtual consultation platform using a combination of hardware and software that could be sent out to a site so that we could use immersive 360-degree video streaming to be able to do a comprehensive consultation of a clinical space and provide real-time support services to help them improve infection control programming. Our team provided over 100 on-site consultations for long-term care centers early in 2020 when COVID-19 was ravaging that community. One of the things that we noted is that when we provided support ahead of time through a series of self-assessments and phone calls, all of the core elements that needed to be in place to prevent transmission and spread of a pathogen appeared to be in place. When we would arrive on site, the thing that we noticed was that the operationalization of these protocols often led to gaps. Some of the behaviors that we were able to see when we were on site were things that we would notice out of our peripheral vision, or parts of a tour through a facility that were not explicitly being called out. That ability to see all around through a video stream as if you were there on site is the piece that we want to try to achieve. Two-way communication using flat video streams such as Zoom or WebEx or Teams really rely upon the person leading the tour of the facility to show the consultant what they want them to see. We want to go beyond that. We want to give the virtual consultant the ability to look around and see all of the things that they might pick up on that the person on site isn't aware are even happening. This is where the 360-degree video stream comes in. So our problem that we want to solve is to be able to create an application that allows us to have two-way communication, live streaming a 360-degree video in 4K or 8K resolution. In addition, we want to be able to have a hardware kit that is as turnkey as possible. We understand that when we send this kit out to small and rural healthcare facilities, that they may not have an IT department that's on site. They may not have a technology expert that can help them assemble the pieces. And so we want to make the kit that we send out as easy and simple to use as possible, with a reliable connection to be able to have expert consultation within a short amount of time. The challenges that we have run into over the last few years that we're hoping that your team can help us solve is the ability to have consistent connection with a 360-degree video stream that live streams, allowing for low latency. Because we're going to be asking people to demonstrate skills as part of the consultation, it's extremely important that the latency be as low as possible. Ideally, we'd like 1 to 3 seconds. We've achieved anywhere from 10 to 40 seconds with different platforms. The second thing that we would like your team to help us solve for is to be able to have some specific characteristics within the platform to help our consultants capture activities and areas for improvement that we can provide back to the site. So we'd like to embed features such as annotation, screen capture, the ability to facially blur people in the background that don't need to be captured as part of the video consultation. We think that this is going to revolutionize the way that we can provide consultative services. Our focus for this project is specifically looking at infection prevention and control. However, we think that the successful development of a platform inclusive of software and hardware that meets the requirements that we are setting forth can be used in a variety of different institutional programming. We think that this could help with pharmaceutical companies. We think this could have broad application in agricultural programming. This can be used in industries such as meat packing plants and other areas where there might be a need for remote consultation. We have a team comprised of infection preventionists, infectious disease physicians, instructional technologists, senior expert advisors focusing on AWS and technology packages, as well as executive leaders. We are really excited to partner with you all to create this product. What we bring to the table as far as resources is that we have already purchased a variety of different 360-degree cameras. We have speakers, we have connections, we have a lot of the hardware that we're going to need to be able to test out different conceptual builds. In addition, we have set aside specific funding to support the purchase of software and hardware components to be able to develop the proof of concept. We're really looking forward to meeting you all and further discussing our project and how we can work together to achieve our mission. Thank you for listening.